I am Dr. Sambi Abraham, Director, Abraham's Fertility and Gynec Center. On either side of the uterus, you see ovaries. Female can have cancer of the ovaries. The problem with cancer ovary is that they may not have much of symptoms with related to bleeding. They can have irregular bleeding. And not that irregular bleeding is always a sign of ovarian cancer. Can be due to other problems also. But there are certain risk factors. For example, as the age advances, the risk factor increases. There is a popular concept that once menopause is reached, there is no problem with the uterus and ovary. It is not correct. So every woman, even if they have attained menopause, they should screen their ovaries that they are not developing malignancies. And then previous surgeries done on ovaries, endometriosis. Suppose she is overweight, she had irregular periods, she had taken hormone tablets. All these things can predisposed to ovarian malignancy, especially people who had undergone infertility treatment has to undergo frequent checking. Now, people often ask, what can we do to prevent ovarian cancer? What can be done best is to go for screening and then reduce overweight, avoid unnecessary use of hormones, and then if there is a strong family history of ovarian malignancy, better they undergo BRCA1 and BRCA2 mutation study so that that will help to predict the chance of developing these symptoms. And then if there is a risk of this gene mutation, better they undergo tubal surgery, tubal removal or ovarian removal early. So what I mean to say is that ovarian malignancy, every woman has to be aware of that. The biggest problem is that it may not be mimicking with much of symptoms, but they may have slight irregular bleeding which may often go unnoticed. But if they are at risk, like age, previous surgery, history of infertility treatment, endometriosis, that has to be taken care of. And then if there is a strong family history, they have to do a BRCA mutation study, and removal of the tubes will help to certain extent to prevent the development of ovarian malignancy if she wants to preserve the ovary. But oophorectomy, the removal of the ovary and tube in high risk category is also recommended. What I mean to say is that women has to be aware of these symptoms, and even if they had their uterus removed, they should keep a note whether their ovaries were removed or not. Often they don't have papers, they don't remember whether the ovaries were removed. No, it should not be like that. Ovarian malignancy is certainly a risk factor.